toward the posterior aspect of her shoulder, and I'm gonna feel for any apprehension. I'm also looking at her face to see if she has any pain.
Do you just hold on the backside, or do you grip
No,
the?
you pretty much go like this. You can put your hand here on the scapula for support, but you're really looking for translation of the humeral head. Okay, try it.
So what's the difference between that and the posterior drawer then?
Almost, I'll show you.
Okay.
Because posterior drawer should be sitting up.
Posterior apprehension. That's apprehension.
This is apprehension. Go ahead and sit up.
And what is anterior apprehension?
Anterior apprehension is when you're pushing it forward, but you can do that while you're doing the anterior posterior drawer sign. Okay? So, and then anterior apprehension is this too. I like to hold their hand like this and support their arm, and then go like this, like the crank test.
Because crank it anterior is
You're
this way,
cranking
right?
it like this. You're trying to dislocate the shoulder.
That's posterior?
This is anterior.
Oh, okay.
Because this is how you can anteriorly dislocate her shoulder. So posterior, she has to be laying down with her body hanging kind of off the plinth. You bend her arm back like this and you push down on her olecranon process. You give it a longitudinal axial force to try to put pressure on the posterior labrum. Okay, and if you see a lot of translation, or if she has a lot of pain, if you're looking at her face and she has a lot of pain, that's positive. Okay, and of course you want to compare the other side. Yes.
So what kind of things would be indicated for us to do the apprehension?
Well, if she's having instability.
So any kind of, like including like the rotator cuff stuff.
Well, the rotator cuff is more muscular, but if you're specifically worried about the labrum, you want to